it's great to hear some of the exciting, amazing things that are happening around the CMF family. So I'm just going to round up a few other big picture things for you. CMF, as many of you know, is a community of 4,600 doctors, nurses, midwives and students. We're here to unite and equip Christian doctors and nurses to live and speak for Jesus. And just like it says in Luke 9 verse 2, our task is to preach the kingdom of God, to heal the sick in this generation. And it's our generation that we're called to. And we're so privileged here to be embodying this whole life, 7-day workplace discipleship. We're really grateful to Mark Green and to the partnership of LICC that we've had today. So what's been happening in 2020 and 2021 with CMF? What's changed? Well, COVID. COVID has changed everything, of course, but throughout all of that, God has preserved us. He's taught us many things and He's made us stronger. Like many charities, we faced massive financial challenges this year, but I'm so grateful to God that He's sustained us through that. And I'm so grateful to you, our members, for your generous giving, that it's meant that we've ended 2020 with a surplus. We're so grateful. We want to thank you very much for all of that. On a staffing side, we've got a new operations director, Olu Lampejo. She's been with us for about 9 months now, and she's working hard to reshape our essential systems for the coming decade. Just want to give a shout out to her faithful operations team there, Gwen, Eleanor, Diane and Steve, the people that you don't often hear about, but do all of the essential backroom stuff that keep us ticking. So a few words on our 3-year plan. What is our 3-year plan? Well, our usual ministry is, of course, continuing, although shaped by COVID. But our 3-year plan is about an overarching trajectory. It's about sustained emphases, thinking what's going to look different, what's going to feel different, what's going to work differently in 3 years if we achieve that. So we've got different objectives right across CMF and also within departments, and we'll be reviewing them and adjusting them year by year as that progresses. Many of you will know the basics of that. We call it wider, clearer, closer. Going wider by extending our reach, growing clearer by refining our communications, and drawing closer by improving our local networks. And all of that's underpinned by membership and engagement. So what do we mean by going wider? Well, we're looking to grow our membership. We've already heard about this year's project to grow nursing and midwifery membership. You've heard about our students. It's so hard this year when campuses are so virtual to do the usual student recruitment. So do please pray for them. And think about your colleagues. Who do you know who doesn't yet know about CMF and hasn't joined? We'll be looking to reach underreached groups. There's so many ethnic communities within our NHS, whether it's Zimbabwean nurses, Nigerian doctors, Filipino nurses, lots of communities that we can reach. And also in the Republic of Ireland. CMF covers the UK and Ireland, but our links and our ministry there's so much strengthening to do in the Republic of Ireland, and also building our links even further with Northern Ireland as well. Specialty groups and networks. You've heard just now about the exciting conference we had for NHS leaders. Not just doctors and nurses who are leaders, but non-clinical managers. There is no Christian network for them. Can CMF play a part in helping to unite and equip them as well? You've heard a little bit as well about the exciting new movement within allied health professionals, Christians in allied health. If you know a Christian in allied health, tell them about Christians in allied health. And churches. We've got a great quarterly churches e-newsletter. Does your pastor get it? You could ask that question on more than one level, but here I'm talking about, does he get or she get our church's e-news? It's great to equip them and for them to pass on to health carers in their congregation. What do we mean by growing clearer? Well, the clarity of our messaging. How do we express just how awesome CMF is in terms of recruiting, people joining CMF, people staying in CMF, people engaging in CMF? We're really asking, why CMF? Some of you have already seen the great new video that we've just produced, and you'll be seeing that again in a few minutes to help communicate some of that in the current culture. Steve's already mentioned upgrading our website this year, and we're so grateful to you for those of you that gave so generously to our Christmas appeal. That has enabled us to press ahead with the website upgrade project that we're so keen to do. We're going to be investing in our database. There's so much more power in that we have not utilized yet to communicate and respond to our membership. And then conferences and events. Just like today, we've been building on the lessons that we've learned in the last year through COVID. And also we're looking to our AGM on the 12th of June when we're going to be improving the facilities we have at Johnson House to hopefully get a proper hybrid AGM. And we'll be telling you more about that as that approaches. And then drawing closer, you've heard from John about catalyst teams, you've heard about the local groups. Where the rubber hits the road in local areas and local hospitals and CCGs, we need multidisciplinary support networks. But that's not just about CMF, it's about Christians in Allied Health, it's about our friends at Transform Work UK, Heaven in Healthcare as well. There's lots of different organisations that we can work with to make these real organic praying communities in healthcare communities. Membership. We know that CMF is more like a family than a gym. You don't just pay your subs and get something out of it. Of course you get something out of it, but it's about being part of a community where we give and receive mutual support. We really want to communicate that, to draw people in, to grow their commitment. But we also want to be giving back to them, training you, supporting you, just like the things you've heard John talking about, equipping you to serve God wherever he leads. And here's one area where you can engage right now on assisted dying. That's one area where there's so much pressure going on. There's pressure in Westminster, in Scotland, and at the BMA. In Westminster, right now, there's a new all-party parliamentary group launching on dying well. Their website, dyingwell.co.uk, launches tomorrow in order to help push back on the pressure to legalise assisted suicide. In Scotland as well, around the Scottish elections, carenotKilling.scot if you live in Scotland. If you're a BMA member, get yourself to the ARM, the annual representatives meeting in September, because they'll be debating and voting on policy on assisted suicide. And then there's a great new organisation, new group called ourdutyofcare.org.uk. It's the medical arm of our partners, Care Not Killing. So do have a look at their website and join up to that as well. So there's just a few of the ways that we can support you and where you can engage with CMF. So just as we round off, there will be our CMF Spring Appeal coming up soon. We'd love you to engage with us and support us further in that way. More to follow shortly. But finally, if you're listening today and you're not a CMF member, why not? Come on, join up and join in. And if you are a CMF member, think about who is there in your practice, your hospital, your community that you could encourage to join. Asking the question, why CMF? Well, why indeed? Let's have a look at this new video that we've produced.